Coming up on Dr. Cliff Worldwide Vet. While working as the lone surgeon at a spay-neuter clinic run by the JSPCA in Kingston, Jamaica, Dr. Cliff is presented with Auggie, a 100-pound Akita female dog who likely has a severely infected uterus which is at risk for rupturing internally. This might be the toughest and most critical surgery of Dr. Cliff's career, and one has to wonder if after only 3 days in Jamaica, is Dr. Cliff in over his head?
How old is Auggie?
Auggie is 6.
6? Okay, so more like we thought. More like we thought. We're thinking 2 or 3, and we're like, that doesn't make sense. A Pio at 2 or 3, that's not common.
She's about 6.
Okay, so we got this 6-year-old unspayed female Akita, and one of the many reasons why we spay is so that they don't get infections of the uterus, which she has. It's called a Pyometra. It is gross, it is dangerous. Her uterus is going to be big, it is going to be tortuous and twisted. If we do not do this right, the uterus can tear, which not only can result in bleeding, but the pustular fluid, the poison, the infection will get into the abdomen. Not an ideal surgery. Even on a healthy, non-infected 100-pound Akita, a spay is a tricky surgery, and ovariohysterectomy is quite tricky, but this is, the only thing that could make this worse is if it was a closed pyometra, which is when the cervix is clamped shut and all the poison, all the infection, all that evil just sits inside the uterus. But those dogs, they sometimes don't make it through the night. It's pretty serious.
Relax. Relax. Come on, Mom. Relax. Go down.
She's been given her sedative,
Go down.
a nice little cocktail that's going to control her pain, cover her pain, and keep her sedated, obviously.
Good girl.
She's just fighting it a little bit.
She's fighting it.
Yeah.
And of course she's shedding like anything. It's like it's summer. So she's going through her molt.
I will apologize in advance for any swearing I do while I'm in there. The big worry about ticks around here, other than them being an irritant, is they may carry Ehrlichia, which is a bacteria that causes a condition called tick fever. Basically, Ehrlichia attacks the platelets. Where is it? So yeah, these guys basically, if they have tick fever, they start to bleed internally. And doing surgery on a dog with tick fever is incredibly dangerous. And you don't really find out in a situation like this, or in a place like the JSPCA, you find out once you cut into them and they start bleeding like an open sieve. So she got a really good dose of premix, and it's not enough. So we're gonna have to top her up. And the trick is you wanna bring her down to the right level, but you don't wanna give her too much. You're gonna do IV?
Yes.
All right. If there's something you need to do, you can, but it was mostly there may have been a second pair of hands needed. Someone in like orthopedics or something like that. You've done this before. I did this yesterday on the little Wendy puppy and it was pathetic. She doesn't have a palpebral. No eye reflex, like she doesn't have a palpebral. Do you want me to open these, or you all right?
Are you okay with them here? The space kind of little bit.
It is. Is there something I can?
Limited.
Is there a table or something?
One table we have to put in those things. It's in the surgery room, which they're using it. There
Okay,
now.
so maybe I could makeshift with the chair.
Yes. Probably.
Yeah.
Spread something in the chair. And
Gaia, can you have Brandon or someone grab the orange water jug? We're going to use that as a table. I don't know if this is going to work, but I just want it a little bit higher. What do you think? Think that'll do?
yeah, no, it's
Yeah, I don't have many instruments. It's pretty amazing what they're able to do here with sort of limited, and I don't want to say primitive, but definitely limited space and tools and funds. That's the big thing, limited funds with an extremely high demand. So pretty amazing that they're able to get these surgeries done with what sounds like a low mortality rate or low complication rate and smiling all the way. I am struggling to keep a smile on my face. My professors at college would have a fit if they saw us doing surgery like this. But sometimes they're in a bit of an ivory tower. Other times they'd pat me on the back. That'll be enough. That'll be enough for him. Yeah, I can even put some tools there.
Boss me around.
You need some gloves.
Okay.
Sure, because in here is isolation, so we'll have to go.
Okay, just show me. Alright. Is that all the cargo?
Yeah, all the cargo.
Yeah, it's okay. Yeah. Alright, great. Okay, how much do you give?
Normally we give about 10 mils.
10 mils? Okay.
Yes, this is also. The person's name is Garb and so let's write Garb.
All of them?
So for this to go on here, Linval, we do this lap cage for this one.
Okay.
So all this fluid in the abdomen, I was hoping was just serum, but I think it's pus. I think her uterus ruptured. I gotta make this bigger. All the fluid that's coming out is milky and
A lot of pus.
yeah, a lot of pus. Get out of the way. So it's just confirming that she's probably a bit septic and she's got an infection everywhere basically. So that evil poison that I talked about that's potentially in her uterus is now floating in her abdomen.
From the ovary.
Really? It's like it's coming from the ovary
Yes.
and coming out?
Yeah. That's where it's really coming.
Just trying to get this ligament to release.
The ligament's not releasing.
Oh, and I don't want to be that aggressive.
Be aggressive.
Yeah?
Be aggressive.
They don't pop
I don't want the blood
like the
vessel.
uterus?
Blood vessel to
But you gotta be
Slowly given.
You give it.
Give me a.
But you still have to be a bit aggressive with it. On a big dog.
That's it, good now.
Yeah, I can manage with that.
Not a huge one. Well, remember it purple.
Oh,
Mine
so
that is why.
Get that evil thing away from me. Uterus, nothing but troubles. Henry, if you can hook your finger and pull up. There we go. Trust me, you want these intestines back in here. Well, that was definitely the hardest surgery I've ever done. Just finished up with Auggie, the Pyometra Spay. I thought those 2 puppies that I was doing beforehand were tough. No general anesthesia, no IV fluids, no monitoring equipment. They ended up going pretty routine. And then this 100-pound Akita with this ruptured Pyometra uterus that looked like it was chronic. It was probably a month long. I've done Pyometra surgeries before, 18 years veterinarian. I've never done anything that difficult, even in a perfect setting. And this is not a perfect setting. I gotta say though, Pam, the head technician here at the SPCA, and Henry, my assistant, the guy's been here 40 years. Pam talked about him teaching veterinarians. I kid you not, that guy taught me already. I knew I was going to learn stuff coming here for the next few weeks. I've only been here a day and I've already learned so much, so it's pretty amazing. I'm exhausted. I'm still worried about her. That was a major surgery. She's got a major infection we got to deal with. But at least the main stuff's over. I got to change. I'm covered in her blood and fluid and her pus basically. Pretty gross, but I feel good, and those guys helped me along the way now. I'm ready for a break though. I'm ready for some food.
Hi everyone, it's Dr. Cliff here, and I want to thank you all for watching our videos. Be sure to share with your friends and post any comments or questions you may have. You can keep track of us on Instagram and Twitter, and be sure to join our Facebook page. Thanks again for watching, and see you next time.